It was about the third month of internship, and I was on the oncology unit, and I was like a deer in headlight, doing the right thing. It's very nerve wracking. And I walked into this room. It was a lady in her late 40s, and she had ovarian cancer that has gone elsewhere in her body. So it wasn't really a curable condition. And I walk in and I was just trying to write the vital signs. One of the questions she asked me, she said, "Do you think I'll live until Christmas?" It was October. I was really taken aback by the question because number one, I didn't think I was actually qualified to answer such question. I barely knew much about the disease. Such a deep question, I never thought I would be asked. I didn't know how to handle a question like this when you're asked by somebody else essentially asking me about their mortality. So I really uh, got nervous, and she kind of noticed that she could tell that I was a bit uncomfortable when she asked that question, and she smiled and she looked at me and she said, "Doc, don't worry about this. It's okay. You don't have to give me an answer. Just promise me you'll come back tomorrow morning and smile." I walked out of the room just completely confused, and I was really shaken by this because I felt I should have answered something, and it was such a deep question. But what that encounter told me, despite the fact that she's the one who was getting the chemotherapy, she's the one who was not doing well, she was the one in the hospital, she actually felt bad that she made me nervous and uncomfortable. She said, "Hey, don't worry about it. It's okay." She was calming me down, and she also just come back and smile because that's really the human connection between two people who are strangers. I never forgot this. I always think of her as like the angel that, and I felt I have to take care of these people. So it wasn't honestly the science. I'm telling you, it was not the science. It was not a family member that was affected by cancer. I wanted to save life. No, it was the human interaction, the human connection that you forge with patients with cancer that I don't believe it exists with any other type of patients